morning, everyone. This is Dr. Dahabra. I'm a triple board certified, including board certified in aesthetic medicine from the American Academy of Procedural Medicine. A lot of patients, they have a problem with the masseter from slimming, grinding their teeth, and sometimes the TMJ joint pain. So today we are going to talk about the masseter muscle injection. All what you need to know about it is going to be detailed, geared more for injectors, but as the patients as well would benefit from this. The first thing I would tell is that Botox for the masseter muscle injection is off-label use. There is no on-label use for this injection. We'll start with the anatomy. So the masseter muscle will start with the anatomy, and it's located just a little bit anterior to the parotid gland. I'm gonna show you actually here. That's the masseter muscle, and that's the mandible. So the jawline is the border. The anatomy here that we have to be careful is the parotid gland and the parotid duct, as well as the marginal mandibular nerve. And of course the radius muscle here is very, very important. Okay, so that connects actually the corner of the mouth, and it overlaps with the masseter muscle. And we're going to talk about this because it's very important to understand the injection techniques. And you have to understand that the masseter muscle is actually in a shape of a wedge. So it has different layers, superficial, middle, and deep layers. And it converges down, as it comes down, it converges and becomes like more dense and condensed muscle close to that jawline. So it's very important when we're injecting to take that into consideration and to inject, or try at least to inject, most of these three layers. We spoke about all the anatomy and all that stuff. And again, because the radius muscle is connected around the mouth, we have to stay away so that we don't inject that muscle by mistake, and that will affect the shape of the mouth, and it's one of the side effects. The dosing of the muscle injection in this area as well, it's a big muscle, so it needs a lot of units. So it needs anywhere between 20 to 40 units. With my patients, I usually inject them 20 units at the beginning on each side, and then after a month, because that's when you start seeing the effects, if needed, I inject another 12 units, and we would another month, and again, if needed, we'll inject the last 8 units. So the maximum is 40, the minimum is 20. It kicks in a month. The maximum results you're gonna see from this injection is actually in around 3 months. That's the maximum results. And the good thing about this injection, when you get it right, that it'll last anywhere between 6 to 9 months. So it lasts a little longer than when we're injecting Botox for the cosmetic reasons. Indications are different. The people get these muscles for slimming the face. So basically, some especially females, that the lower face is kind of wide and bulgy. So when you inject it, it thins the face and gives the face more of a V shape, where it is wide up and starts to thin down, and gives the more V-shaped and more youthful and rejuvenated look and very feminine look. So that's the first indication, aesthetic. And sometimes we do it for grinding the teeth, bruxism. A lot of people, especially at night or under stress and anxiety, they grind their teeth. That can cause damage to their teeth. So we do it for that as well. And sometimes as well we'll do it for TMJ joint pain. So just to show you here as well, the same thing. So this is the joint that connects the mandible again with the temporomandibular joint. So that's the joint that causes pain in some people. And then when the muscle in this area, sometimes we inject the masseter muscle here and the temporal muscle, because these two muscles actually affect that joint. So maybe I'll talk about the temporal muscle injection later on, but the masseter muscle is also one of the muscles that affect that joint and can cause pain, and injecting it can alleviate pain in some patients. The side effects, there's some common side effects that we see with any injection, from swelling and bruise. Doesn't happen, minor side effects, they go away by themselves, bruising, all that stuff. But we have what is called paradoxical bulging, or Popeye muscle. Okay, so sometimes remember, that's why the anatomy is very important. I told you that it is a wedge shaped, so many layers up, and as we start going down, it becomes more condensed. So if you inject only one layer and not the other, then the other layers become kind of stronger, and then you can actually see the muscle popping out, even getting worse. It's one of the side effects. The good thing about this is that you inject that layer, and then it can be fixed. The more the feared side effect is the asymmetric smile. Again, when we inject the risorius muscle by mistake, then that also will cause actually asymmetry of the face, and it's just really big problem. And because you have to wait it out, sometimes what we can do is just to inject the other side and try to bring some symmetry as well. It's not the best solution, but it's better than only having one side that is asymmetrical. And the other thing is xerostomia, which is also dryness of the mouth. Remember that when we do sometimes Botox for under the armpit and the hands for hyperhidrosis with excessive swelling, well, we spoke about that in the anatomy with the parotid gland as well. And if we inject that gland or the duct of that gland, it can cause the same results when injecting Botox for hyperhidrosis, which dries that gland, and the patient will feel like dry in the mouth. It's annoying, but it's not as serious as asymmetry of the face that patients sometimes have to live with for months. So it's really important to understand the anatomy. I'm gonna show as well exactly how to avoid that and where to inject. Okay, so the best way is just to go from the corner of the mouth and go to the tragus, from the ear. So that's the line, okay, like this. And then I'll ask the patient, can you clench? Okay, so I see the anterior border, so that's the anterior border. And then that's posterior border. And then, okay, so the gland actually is here. And then clench again, okay, and then that's the, okay. So this is the borders of the gland actually. It's kind of like this here. So that's the line that I have to be below that line and not to go above, so that I don't affect the facial muscles, including the zygomatic and the risorius muscle. And then that's the anterior border of the muscle, so you have to stay kind of 1 centimeter as well lateral to that border. So if I stay below that line and lateral to the anterior border, so if I inject in this area, I'm kind of safe, okay? And again, remember that actually the bulk of the muscle is in the lower, so I have to inject, I like to inject a little bit more in the lower part. So inject here, here 2, and then 3. So they're all like kind of the lower side, the inferior side of the muscle, because that's where the bulk of the muscle is. You have also to be careful with the older people, that muscle is kind of like really holding the tissues together, so it can result in exacerbation and making the jowling worse in older people. So you just avoid it in older people, so that you don't make that side effect as well. Dosing wise, we spoke about this. We said anywhere between 20 to 40 units, let's say 20 units. Then you have a 2 pattern, either the 3-point or the 5-point. If you inject the 3-point, again, 1, 2, 3, lateral to the anterior border, below that line, more to the lower side, and then you can inject 7, 7, then 6, so that's 20. And then if you're gonna do the 5 points, then we can add 1 point here, 1 point there, so that's 5 points. And sometimes I inject 4 points, so 5 times 4 is 20 units. So that's the pattern of the injections, either 3-point or 5 points. And then the needle that you use is 30, 31, 32 gauge needle, small, needle, and then at the same time, like maybe half-inch needle. Some people will ask the patient to relax while they are injecting, which is fine, but personally I ask actually the patient to clench while I'm injecting. First, it distracts them, and the second is that it brings the muscle actually more superficial, and then I can inject better in the bulk of the muscle because I feel it, it's more superficial, and it distracts the patient. And then while I'm injecting, when I go in, I have a lot of other videos. Actually, I'm injecting real patients, so you can look at these and then my channels, social media, YouTube and Instagram. When I'm injecting deep, and as I'm injecting, I start drawing a little bit, so I'm inject at different layers. Okay, so I don't inject only superficial, middle, or deep layers. Some people actually, when they inject superficial and then they come out and they go deeper. So these come two separate injections to inject the different layers. But I do it as I'm drawing as well. So again, these are the main things about the Masseter muscle injections. I hope that you get a lot of information from this. If you have any questions, any comments, any personal experience as a patient or as an injector, please let me know, and please subscribe to that channel so that you're gonna see more and more injections and patterns in details, so we all learn together. So if you have any question, again, let me know. Thank you and have a great day.
So as I showed in the demonstration video, already did the drawing. So that's from the corner of the mouth to the tragus of the ear. So I have to stay below that line, and then I already felt the masseter, and that's the border. So as I said, the bulk of the injection is going to be kind of like try to be in the lower. I'm going to inject 20 units, and of course I'm going to be a little bit 1 centimeter behind the anterior border. Okay, so and I'm going to ask the patient to clench. Okay, so that bulges the muscle out, so it's more superficial, and I'm injecting as I'm actually moving the needle coming out, so that I'm almost done here. I inject the different layers. Okay, so sometimes all this little bit, I don't like to lose anything, and then I re-inject them back, and that's it. If you have any question, again, let me know.